This presentation aims to provide a clear and practical guide to understanding dementia diagnosis for individuals without a medical background. We will explore how to recognize dementia, key signs to observe at home, the diagnostic process in a clinical setting, and the medical assessments involved. We will begin by discussing how to recognize dementia beyond simple memory loss. Next, we will identify key signs to observe in everyday settings. Then we will review the diagnostic process typically used by doctors. Finally, we will explore medical assessments that support a dementia diagnosis.
Dementia is more than just memory problems. Recognizing patterns of cognitive changes and understanding how dementia differs from normal aging are important. Also, noticing how these changes interfere with daily life helps identify when to seek medical advice.
There are some typical patterns of cognitive changes that are helpful in identifying dementia. One of this is the consistency. Consistent cognitive decline. The family should pay attention to identify ongoing difficulties in thinking and reasoning that progressively worsen over time. Also to be assessed is the actual impact on daily tasks. Cognitive changes affect the ability to perform familiar tasks reliably and independently. Distinguishing forgetfulness from occasional lapses of memory is crucial. It helps to differentiate between occasional forgetfulness and serious cognitive impairments requiring attention. Look for consistent and progressive difficulties in thinking, reasoning, and problem solving. These changes often affect the ability to perform familiar tasks and should not be dismissed as occasional forgetfulness.
Normal aging causes minor memory lapses that do not impact daily life or overall cognitive function. Severe cognitive decline in dementia involves significant cognitive decline that impairs daily functioning and independence. It cannot be emphasized enough how important it is to identify dementia early. Understanding differences helps prevent confusion and enables timely diagnosis and care planning. Normal aging may involve some memory lapses, but dementia includes more severe cognitive decline that affects daily functioning. Understanding this distinction helps avoid confusion and delays in diagnosis. Let's look at how the cognitive impairment interferes with daily life. Cognitive decline can pose significant daily activity challenges. Dementia causes noticeable difficulties in essential daily activities like managing finances, cooking, and personal care tasks. So what are the indicators for evaluation? When should you consider going to the doctor? Interference in daily tasks is a critical sign indicating the need for professional dementia evaluation. Dementia typically causes noticeable difficulties in daily activities such as managing finances, cooking, or personal care. These interferences are key indicators that professional evaluation is necessary. Family members and caregivers play a crucial role in recognizing dementia. Observing changes in thinking, behavior, personality, and orientation can provide important clues for early detection. Let's look at some of the thinking and memory issues that we can observe in patients with early cognitive decline. One of this is forgetting recent events. This is seen commonly as an early sign. You find the individual forgetting recent events, which can cause confusion and concern in daily life. The patient may forget he already had lunch or that some family member had visited the previous day. Another aspect to look for is the difficulty in performing tasks that are otherwise familiar. People may feel embarrassed and hide their inability to do such simple things such as tying their shoelaces or opening a slightly complicated lock that they previously had no difficulty with. When someone is struggling to perform familiar tasks, it is an indication of disruption in cognitive functioning and daily routine. Another aspect is repeated questioning. Sometimes you may find the individual repeatedly asking the same questions, such as the time of an appointment or whether you have locked the door, and other mundane things reflecting short-term memory problems and confusion. Yet another aspect is poor judgment, which may involve the mundane as well as the big stuff. Poor judgment leads to decisions that negatively affect daily living and safety. Signs include forgetting recent events, struggling with familiar tasks, repeatedly asking the same questions, and poor judgment. These symptoms often disrupt routine life and signal cognitive decline. In this cartoon example, the husband has become forgetful and the wife has to write down the grocery list, but that does not solve the issue.
Hey, Bob, you forgot to get the groceries again, even after I wrote the list down for you.
You know what, Sarah? Last time I had taken the list but forgot the money. But this time I put them both in my shirt pocket, and then I go and forget to wear that shirt.
Oh no, Bob. I guess we will have to just live with your memory issues, won't we?
Difficulty with tasks, struggling with daily routines that were once familiar, like cooking a meal or managing finances.
Hey, Anne! You forgot to add sugar in the tea. You know I like it with milk and sugar.
Oh, darn. I thought I had forgotten to put the salt in it.
I guess you need to go through the cooking classes again, Anne.
Asking the same questions over and over again within a short period.
Doc, my mother asks me at least 10 times if I have packed my stuff for work every day.
That's because, as a child, you were always missing things when going to school.
I am not a child anymore, Mother. And besides, I am married.
Another issue is about poor judgment. The patient with cognitive disability end up making uncharacteristic decisions, such as wearing a coat on a hot day, as in this example.
So, Pete, why do you think your father is losing his sense of judgment?
Well, Doc, he was wearing a coat and tie and wandering about the streets in them.
What on earth is wrong with that, Pete?
I will tell you, Doc. It's middle of summer, he is fully suited up, carrying an umbrella like it's raining. He nearly had a heat stroke.
Behavioral and personality changes mood swings. Frequent mood swings can indicate underlying behavioral changes linked to cognitive decline or dementia. Personality shifts. Notable changes in personality traits may signal progression of mental health issues or dementia. Loss of interest. A decline in interest for previously enjoyed activities is a common sign of behavioral change needing attention. Mood swings, noticeable personality shifts, and loss of interest in previously enjoyed activities may be signs of dementia. Monitoring these changes helps in early identification and support. Mood swings, becoming unusually anxious, sad, or irritable for no clear reason.
People can be anxious when they visit a doctor. That is quite understandable.
But Doc, he has been anxious about nearly everything. Last week, he was scared to go to his brother's home. I had to escort him.
I can visualize that. Can't consider that unusual. Maybe he has forgotten the way?
But Doc, my uncle lives just around the block, and our homes have been there for the last 30 years now.
Personality shifts. A change in personality such as becoming paranoid, fearful, or withdrawn.
Have you seen any changes in his personality recently?
My dad was always friendly and affable, but recently he has been withdrawn and disinterested.
Is it for any reason, like he does not know the people or no longer recognizes them?
He has become more suspicious. He is always wondering if some old friend of his has come to check on him, maybe to report on him. He is practically paranoid these days.
Another common issue is loss of interest, losing motivation and interest in hobbies or activities that were once enjoyed.
Doc, you asked about his hobbies and interests. Well, he always looked forward to my sister's visits, because she has 5 kids, and he always enjoyed their company.
So how has that changed now?
Well, he looks lost, hardly asks them anything, shows no interest when they share their stuff. The kids are quite sad at this change.
Disorientation time confusion. Individuals may forget the current date or time, leading to significant confusion. Place confusion people can become unaware of their location, posing safety risks in unfamiliar environments. Safety concerns disorientation requires prompt attention due to potential dangers from inability to navigate safely. Confusion about time and place is a common symptom. Individuals may forget where they are or the date, which can lead to safety concerns requiring prompt attention. Orientation to time, place, and person is crucial for daily functioning. This can get impaired for various reasons: delirium due to fever or intoxication, general weakness due to an illness such as diarrhea, etc. But the demented patient appears awake and alert but disoriented.
Doc, you asked about unusual behavior. Well, Edith got ready to go out on a date last week.
That sounds good, Bert. Looks like Edith has perked up. Wasn't that your complaint? She is not showing interest?
Well, I would be happy, Doc. Only thing is, it was in the middle of the night. She had to be taken outdoors to show this was not day yet.
Gathering detailed background information about symptoms, medical conditions, medications, and family history helps doctors understand potential causes of cognitive changes. Tests like the mini-mental state exam and clock drawing test assess memory, concentration, and executive function. These are simple, standardized tools used to evaluate cognitive status. Doctors assess how cognitive difficulties impact daily living activities to differentiate dementia from other conditions and determine severity. The mini mental status examination takes about 10 minutes, requires the patient to be awake and alert with glasses on if required to read. It's a time-tested method and can be easily performed in the office. The test gives a clue to the doctor to differentiate trivial memory lapses and other such complaints from real cognitive impairment that may require further evaluation.
As part of the MMSE or separately, the doctor may ask you to draw a clock face showing a specific time. This evaluates for executive function as well as visuospatial skills.
Cognitive tests are standardized and easy to perform and are crucial to detect impairment in cognitive functions that may be subtle and undetected by the family. Additional medical tests help confirm the diagnosis and rule out other treatable conditions. These assessments provide a comprehensive view of brain health. Imaging is used to rule out other problems like a tumor, stroke, or fluid buildup in the brain. MRI scan provides a detailed look at the brain structure. In some cases, it can show the shrinkage associated with certain types of dementia, like Alzheimer's. CT scan creates 3D images of the brain using X-rays. PET scans using specific tracers can aid dementia diagnosis by showing brain function, amyloid plaques, and tau tangles. MRI, Connecticut, and PET scans visualize brain structure and function, helping detect abnormalities such as atrophy or other causes of cognitive impairment. Scans of the brain may be ordered initially to rule out conditions like brain stroke and tumor. MRI scan can also identify fluid collections, which can signify normal pressure hydrocephalus, which is a treatable cause for dementia. CT scans can provide information and are useful when patients are claustrophobic or uncooperative for an MRI scan. PET CT scans are specialized techniques requiring nuclear tracers. They are not universally available. Most of the time, PET CT scans are performed for cancer screening. For neurological conditions like Alzheimer's disease, frontotemporal dementia, Parkinson's disease, special tracers are required and are not commonly available. These are much more accurate for diagnosis of dementia, but are not commercially available. Blood tests are ordered to check for treatable conditions that can cause dementia-like symptoms, including vitamin deficiencies like B12, thyroid or kidney problems, infections, or blood clots. Specialist referral. After the initial screening, the doctor may refer the person to a specialist for further evaluation. These specialists may include a neurologist, a geriatrician, or a neuropsychologist. In some cases, referral to a neurologist, geriatrician, or memory clinic is needed for advanced testing and management planning. Recognizing dementia early through observation and understanding the diagnostic process empowers non-medical individuals to seek timely medical advice. Comprehensive evaluation ensures proper diagnosis and care planning. So, to conclude, dementia is a common condition, especially in the elderly. It can cause a lot of distress to family members and caregivers. It is important to identify early and treat those conditions that are reversible. For this, family members will need to pay attention to early signs of dementia. Memory lapses and mood swings can be common in the elderly. The important question would be, are these significant, consistent, interfering with daily activities? Get an expert medical opinion when in doubt. Your doctor will screen the patient for signs of early dementia with the mini mental status examination. Your doctor may perform certain blood tests such as vitamin B12 levels, thyroid function tests, and rule out other medical conditions or infections. A brain scan may be ordered to rule out stroke, tumor, and other common conditions. The patient may then be referred to advanced centers and to experts such as neurologists, neuropsychologists, and higher-level evaluation may be carried out. Hope this brief summary helps you to identify the problem of dementia early so that your loved one can be diagnosed correctly and started on early treatment. That's all for today. See you again in the next video with more such useful information. Goodbye.